This presentation aims to explain the treatment of cavities at the Tokyo International Dental Clinic in Roppongi. If you watch this video and agree, please fill out the consent form for the cavity treatment. If you have any further questions, please ask us. This picture shows an example of the procedures during cavity treatment. The left upper image shows the initial status. The right upper photo shows the cavity after grinding. The left lower picture shows the cavity during filling. The right lower picture shows the cavity after the plastic filling. Sometimes, you need to cut the gum unexpectedly if you have an inflamed gum. This video especially explains the differences between the Japanese insurance treatment and the private treatment of treating the cavity. There are some differences between the two treatments in terms of grinding the tooth, using a hand instrument, moisture control, and materials. In general, private treatment is more reliable and carefully administered. We have a limited time within the Japanese insurance treatment, so we use a high-speed turbine to grind the tooth. It may be difficult to tell if the ground area is hard or soft by the high-speed turbine. Usually, we differentiate them by color. So, we tend to grind a tooth more than necessary for the insurance treatment. This treatment is recommended for shallow decay. A hand instrument can be used for private treatment to avoid unnecessary grinding. However, removing a caries lesion with a hand instrument takes longer. Furthermore, we use the surgical microscope to check for any remaining cavities. This is an example of the private treatment for a cavity in a 10-year-old boy. First, the high-speed turbine was used to remove the carious lesion of the enamel. Then the hand instrument was used under the microscope to remove all the carious lesions, but not to remove the unnecessary part, which is shown as brown. That area was very hard, and we didn't need to remove it. All the procedures are done under the rubber mask and the microscope. The white plastic material was used to fill the cavity. The rubber mask is essential to prevent the wet surface. This patient had a big cavity that was only detectable by the radiographs. The gum was inflamed. When I grind the cavity, the gum bleeds a lot, growing over the tooth. With such a wet environment, the filling does not adhere to the tooth very well and produces a leakage. Gum is inflamed in many situations, but the patients can't recognize it. Very often, it is necessary to cut the gum. If we pass this procedure, the results will be like this. In the clinic, we usually see those leakages below the fillings. Amazingly, ideal filling is rare, unfortunately. This leakage will produce another problem, the need for root canal treatment. On the other hand, for private treatment, we use a rubber dam to avoid a moist environment. We use the best materials for private treatment. However, the most important differences are the treatment time and the use of the microscope. The Japanese national insurance fee is very cheap, from 1,000 yen to 2,000 yen. So we only need 30 minutes to treat a cavity. The private treatment fee is 60,000 yen plus tax and requires more than 60 minutes. There are huge differences, so please decide how to treat the cavity by yourself. Plastic fillings often come off due to your biting habit, especially if you grind your teeth at night. If the filling comes off very often, we should treat that tooth differently or use a night guard. If you develop any clinical signs, such as sensitivity or pain after the treatment, please call us immediately. Thank you very much for listening to the procedures for the cavity treatment. If you have any further questions, you can discuss them before the treatment. Otherwise, please fill out the consent form for the cavity treatment.